salon done then at least say oku belle woman dey die from belle. And I believe say one of the reasons we make that they happen na because some man they fail for Kana hospital fast as in they tell you. You go don't begin can 1 or 2, they avoid, they go to one mommy or they corner you go born. But if you continue for the car hospital, then they check you, then they monitor you and you became. I'm not sure say belle woman will continue for dying at salon.
If you have 2,000 people dying every year, and you think that this is a gradual thing, or no, it's an emergency for us as a ministry. It's an emergency that we could do something about. A lot of these deaths are preventable deaths.
We don't like the ugly picture. It is ugly. We don't like it. We want to identify with it so that we can proffer solutions, but we don't like it the way it is. So that is why the minister has declared it an emergency and has also called on global leaders to really come on board and help Sierra Leone. So there is political commitment and leadership, and this has also translated to the technical people who are us here as well. And we are running with our vision and with our passion. So that by the time the SDGs, the 2030 for the SDGs, will be in line with other countries.
You can see that most of these maternal cases that do come to the hospital, the reason why they have been delayed to care for is the inadequate supplies of commodities that we need to save those lives. Our hospitals and PHUs, where they are giving this maternal service, you can see that the environment is not ideal, is not conducive for such care. So if we want to say we want prompt actions to be taken, then definitely that one needs to be addressed in terms of making the environment user-friendly for maternal health services.
If we improve on the family planning issues, I'm sure that one will save the lives of our mothers and our young girls.
From the time I get the can clinic, then the service me well, and they really take care of me. Anything when happen to me, they say, "But I can't complain," and they can't treat me. So, me belly heart, I can't go really above normal, no problem, no dating, no complications. So I count them because it get fever. They get fever so that they don't treat them.
For maternal, we have our PHU staff, our peripheral health unit staff. We have what we call QOC, quality of care, that is being put in place so that we'll reduce, because we will not be able to stop mortality at all costs. With the help of WHO, IPC, quality of care, all this has brought the maternal mortality and child mortality down.
En fait, ayen kabala an fi kakoko. Amodo mo ito do hospital le pai eneso. An fi matur an komia sono do hospital la man kokom.
In Sierra Leone, we have been battling with maternal mortality. For the past 10 years, we've been one of the countries with the highest maternal mortality. Even though some progress has been made, but we're still among the top countries with high maternal and as well as child mortality. Because our target for the next 5 years is to bring maternal mortality to at least 300 and below. Because now we are at 717, which is still unacceptably high. The WHO has been a very formidable force in helping us to reduce maternal mortality. They've been with us in every step of the way, starting from training of our healthcare workers, to supportive supervision and monitoring, to coordination. They've given us technical support. They are so flexible that they are ready to do anything.
Over the years, a lot of midwives have been trained. But I think the other challenge is like decentralizing these midwives. Most of them are in the center of Freetown, right? They are not posted to provinces. Some are there and doing very well, but I know the issue of monitoring within the PHUs, and the hospital, the major hospital cannot admit all the patients. Some patients will go to the PHUs, and then once there's a complication, they have to be referred. Sometimes, like with these pregnant women, you are dealing with two lives. You have the mother, you have the child. Sometimes you will save both, sometimes you will save one, sometimes you cannot save either. I have a vision that in the next 5 years, we have to work on reducing the current maternal mortality that is currently at 717 per 100,000 lives to at least more than 70%. That will be below 200. And with the help of WHO, who have been partners with the ministry, we believe that goal can be achieved with their support.
Every pregnancy counts, just like every case of Ebola counts. Otherwise, we'll sit here, people will be dying in Kailan because of lack of obstetric care. They'll be dying because they don't go up for their regular visits. You find out about that 1 year later. In fact, 2 years later, because it takes another year to collate the information and all of that. So what we want to do is, for Ebola, you don't wait till next week. You monitor it there and then. So we want the same principle to monitor every pregnancy and track it.